Good day everyone, I'm Alexander James Swipe Palad and I'm from BSN22. So for today, I'm going to show you the proper procedure of the administration of enema. So for the purposes, it is a technique used to stimulate stool evacuation. It is also a treatment used to relieve severe constipation. It is also a management used for cleansing, carminative retention, and return flow. So for the assessment, we need to assess for the following. We need to assess for the patient last bowel movement, amount, the color, and the consistency of the stool. We need also to assess for the presence of abdominal distension. And we need to assess also whether the client has sphincter control and the availability of the patient to use toilet or commode or a bed panning bed. Next, we're now going to proceed on the planning. So, determine the following. So, determine the presence of kidney or cardiac disease that contraindicate the use of enema. We need to determine also for the doctor's order for a need of administering enema. Next, we're going to assemble all the equipments that we're going to use. So, we have here a rectal tube, a drainage bag, a lubricant solution, a alcohol for hand hygiene, a correct amount of enema. Let's assume that it is commode or bedpan. A paper towel, a clean towel, a blanket, and also we have a gloves. Okay, so after we assemble all the equipment, we're now going to proceed until preparation. So we're going to put the right amount of enema on the drainage bag. Then make sure that you lock it. Then after that, we're going to lubricate about 5 cm to 2 inches of the rectal tube. Then run some solution through the connecting tubing of a large volume enema set and the rectal tube to expel air in the tubing, then close the clamp. So here, we're going to lubricate it. Then I'm going to place it here. So after we lubricate, prior to the procedure, we're going to introduce ourselves and verify the client's identity using two identifiers. Then explain the procedure, what we're going to do, why is it necessary, and how the client can cooperate. Indicate that the client may experience feelings of fullness while the solution is being administered. So, good day ma'am. I'm Alexander James Swipe Halard and I will be your nurse for today. So, may I see your tag, ma'am? Okay, ma'am. So, may I know your full name po? How about your birthday po? Ma'am, there's a doctor's order here po that I'm going to, I will be doing, enema administration po. So, ma'am, later, ma'am, when the enema is being administered to you po, do you feel any fullness po and a little bit pain, so but you can tolerate po. So if you feel severe pain or discomfort po, you can complain po, so that I will give you an immediate treatment po. So is it okay with you, ma'am? Okay, so after explaining the procedure, we're going to perform hand hygiene and provide privacy for our client. So I'm going to perform hand hygiene. Then I'm going to close the door and close the window and draw the curtain. So as you can see, I already closed the window and the door. Then after that, we're going to assist the client in a left lateral position with the right leg as acutely flexed as possible and the linen saver pad under the buttocks. So ma'am, I'm going to assist you po in a left lateral position. Okay po, so I'm going to position you po in a left lateral position. Then I'm going to place the linen saver pad here at the buttocks. So make sure that you expose only the area where you're going to examine. Okay, so after that, we're going to insert the enema tube. So for the client in a left lateral position, lift the upper buttocks. Insert the tube smoothly and slowly. Okay. Then, we need to insert it slowly in the rectum, then directing toward the umbilicus. We need to insert only about 7 to 10 centimeter or 3 to 4 inches. If resistance is encountered in the internal sphincter, ask the client to take deep breath, then run a small amount of solution through the tube. Then, always remember that never force tube or solution entry if instilling a small amount of solution does not permit the tube to be advanced or the solution to flow freely. Then withdraw the tube. After that, check for any stool that might have been blocked the tube during insertion. If present, flush it, then retry the procedure. So if resistance persists, end the procedure and report the resistance to the healthcare provider and to the nurse in charge. Then slowly administer the enema solution properly. Okay, so we're going to administer now the enema solution. Then, raise the solution container and open the clamp to allow fluid or compress the pliable container by hand. Okay, so we're now going to open the clamp to allow the fluid flow. Always remember that during most low enemas, hold or hang the solution container no higher than 30 cm or 12 inches above the rectum. But during a high enema, hang the solution container approximately 45 cm or 18 inches above the rectum. So now we're going to administer the fluid slowly. If the client complains of fullness or pain, lower the container or use the clamp to stop the flow for 30 seconds. Then restart the flow at a slower rate. Okay? So, ma'am, do you feel any pain or fullness? Okay, so do you feel any uncomfortable or irritation or discomfort with your position or the enema that been administered to you, ma'am? Okay, so after that, we're going, if you are using a plastic commercial container, roll it up as the fluid is instilled. After all the solution has been instilled or when the client cannot hold anymore and feels the desires to defecate, close the clamp and remove the rectal tube from the anus. Then place it on the disposable towel as you withdraw it. Okay, so we're going to place the disposable towel here. Then we're going to then I'm going to dispose it. Then after that, encourage the patient to retain the enema. So ask the client to remain lying down, then request the client to retain the solution the appropriate amount time for 5 to 10 minutes. The cleansing enema for retention enema naman, it will be 30 minutes. So ma'am, are you willing po to maintain lying down po to 5 to 10 minutes po for the cleansing enema and 30 minutes po for the retention enema? Okay, so I'm going to help you, ma'am. Lying down. Okay. So after that, we're going to assist the client to defecate. So assist the client in a sitting position in a bedpan. So let's assume that it is the bedpan. So we're going to assist you, ma'am, in the bedpan. So okay, so after assisting the client in a bedpan, observe the feces on the bedpan or commode or in the toilet. If a specimen or feces is required, ask the client to use bedpan or commode. Okay, so are you done, ma'am? So we're now going to remove this disposable linen and we're going to perform hand hygiene again. So for the variation of administering enema to an incontinent client, after the rectal tube is inserted, have the client assume a supine position on a bedpan. The head of the bed can be elevated slightly to 30 degrees for easier breathing. So for the variation naman, for administering a return flow enema, for the procedure, for a return flow enema, the solution, 100 ml to 200 ml for adult, is instilled into the client's rectum and sigmoid colon. Then the solution container is lowered so that the fluid flows back out through the rectal tube into the container, pulling the flatus with it. So the inflow outflow process is repeated 5 or 6 times, and the solution is replaced several times during the procedure if it becomes thick with feces. Okay, so I'm going now to remove this. Then I'm going to discard and clean all the materials. Then for our evaluation, document the procedure. We're going to document it. So we're going to document the type and volume if appropriate of enema given, the type of solution, the length of the time solution was retained, the amount, the color, and the consistency of the returns, and the relief of the flatus and abdominal distension in the client's record. Then observe for possible reaction to the administered enema. So, ma'am, do you feel any relief as I administer the enema po? Naginhawaan naman po ba yung pakiramdam nyo? Or do you feel any pain or any comfort? Okay, that's good po. So, that's all for the procedure of the administration of enema. Hope you learned a lot from this video. Thank you for watching. Bye!